Lymphedema channel, where we spotlight this chronic condition to offer hope and education and inspiration to all of you out there. I am so honored to welcome Marie McGowan to the Lymphedema channel right now because she is a senior therapist and a physical therapist with Prisma Health in South Carolina and passionate about lymphedema. And I want to ask you, where did that passion come from, Marie?
Really from my patients. I did not, people have asked me, would you have thought you would end up here when you started your career? And I absolutely would not have. But somehow I have kept getting pulled back into cancer and lymphedema. And my patients just inspire me so much as to what they deal with and live with and how they survive.
So, one of the things that's always confused me is that not every cancer patient ends up with lymphedema.
Correct.
And is it a predisposition to the condition? Is it the unluck of the draw?
Yeah, well, oftentimes it is treatment related. So the more treatment that somebody has in terms of number of lymph nodes removed or radiation, infections, things like that, the more likely they are to develop lymphedema. But there is also that unknown factor. There is sort of a group of people that you'd look at and say, I don't really understand why you have it based on your history. And, you know, we think there may be some genetic component to it, but we just really don't know.
The thing that breaks my heart is it's hard enough to go through a cancer diagnosis and
Right.
then to sometimes even years later develop lymphedema. That's a
Yeah.
psychological hit as well.
It is. And oftentimes dealing with lymphedema for my cancer survivors is harder psychologically for them to deal with. They're more angry about it. They're more upset about it than having gone through cancer, you know, surgeries and treatments and survivorship than they are, you know, with that part of it.
Is it, do you think, because they didn't anticipate this? But then again, you don't want to overwhelm people in the front end. By the
Correct.
way, if you have this treatment, you might develop lymphedema. That would be quite a hard pill to swallow.
It is. I do find we see patients from at the time of diagnosis all the way through survivorship. And so I find that women and men, but I work a lot with breast cancer survivors, they appreciate that information and they welcome it. You know, the hardest thing to hear is nobody told me that this could happen years later, or, you know, those sorts of things. And that I think is part of the anger. So when you talk to people and you say, these are things to look out for, don't worry about them all the time. But again, just something to be aware of. I think people appreciate that information more than not having information.
And so for someone like you bring the clinical expertise, but being empathetic to that other component, it takes a very special person to treat these patients with the dignity and the care that they deserve.
It does. It does. And part of it is that I have lipedema as well. So understanding, having some life experience in going through a period of time where I didn't know that's what I had. Why do my legs hurt all the time? You know, why do they feel so heavy at the end of the day? Until I got that diagnosis, you know, that's quite a process. And so to understand where people are coming from, I think is really important.
So now you've definitely touched on something I want to get into a little bit, because I have immersed myself in this condition that is lipedema, so
Yes.
underdiagnosed.
Correct.
And so much stigma attached to the physicality of it for
Correct.
so many women, and legitimizing this condition and letting the clinical community be aware of it enough to diagnose it and offer the correct treatment for
Correct.
it. So let's go back. You said it didn't happen right away. How did you get your own lipedema diagnosis? And
Um,
how did it present in your life aside
sure.
from the hurting legs?
Sure. So from the time I was a teenager, I mean, I always had sort of the bigger lower body. You guys can't see me, but my patients always, I'm relatively thin, but my patients will say, you don't look like you have lipedema. I'm like, you haven't seen me with my clothes off. Um, but to understand that I didn't look like other women did.
Mhm.
And then, yeah, go
I
ahead.
want to just say too that what I've also learned is lipedema comes in all shapes and sizes.
It
There was
does.
a woman I interviewed who was like 5'8" and 140 pounds. She was certainly not in any way clinically obese, and yet she had the fat pads, she had the nodules and the pain. So
Mhm.
I think it's so important that we say it can look a lot of different ways. But so you felt like there was a little something off at what point in your life? Puberty?
Um, yeah, around the time of puberty, but just not really able to put any words to it. Um, During pregnancy was really when it showed itself. So, they talk about the 4 Ps with lipedema, puberty, pregnancy, and postmenopausal. And I definitely have lived that.
Yeah.
Because during pregnancy was when my legs really started to swell a lot more and hurt. I also realized that my legs were looking like my grandmother's legs did, and those sorts of things as I got older.
And so here you are, a medical professional.
Mhm.
Did you try to diagnose yourself? And how did you, and most of these women end up Googling and discovering
Right,
lipedema.
right, right. No, I actually thought that I had just some venous insufficiency because I work on my feet all day
Mhm.
and that sort of thing, and went to a vein doctor, and my veins are fine. And I was actually at a continuing ed conference on lymphedema. I was a lymphedema therapist at that time, but going to a lecture on lipedema. And as she started describing it, I was like, that's me. I have this. And, and to suddenly realize that was what I had. And of course, went up to the speaker afterwards and went, I think I have this. What do I do?
That's a breakthrough moment. So you
It
asked, what do
was.
I do? How did that person respond?
Well, she talked to me about, exercise I could do, diet that I could do, continue to wear it because I had been wearing compression, but bringing it up over my thighs and that part of it. So, because I'd been wearing them to the knee for a long time. And so bringing it up and it really did help my pain significantly. And then just as a knowing what I know and educating myself, I added in some SelfMLD and have managed it very well.
That's excellent. So do you do self-MLD?
I do.
And there's a lot of people out there perhaps that are just on their journey, and maybe it's not convenient for them to get
Correct.
out and get therapy all the time, especially in the world where we're at right now, where people are still cautious about leaving their homes and going to offices. Are
Correct.
there, I mean, I don't want to put you on the spot, but do you have any particular tips or hints about self-MLD?
Sure. Doing it regularly is important. Carving out a time to be
Do you
able to
mean
do
daily?
daily,
Okay.
right? And I oftentimes combine it with yoga or breathing, so it's part of my exercise routine as well. Carving out that time and making time for yourself, looking at it as self-care,
Mhm.
I think is important. And I also use, and not for myself, again, because I think I'm a little bit of the specialized case in that I am trained in the techniques as well.
Sure.
But for my patients, I do use compression pumps as well to help them with that.
Mhm.
Because oftentimes they either can't reach their legs or their arm in a way that's effective.
Yes.
And so there are other modalities that people can use
And
at
everybody
home.
watching this is like nodding their head and saying, we know Brenda represents Lymphopress, so I'm a true
Right.
advocate, because I've seen, first of all, it's got to be easy to use, or
Correct.
else because of the mobility issues and the pain, it's got to be something easy to use and effective and pressure enough to break up that fibrosis too.
Correct.
Um, Let's talk fibrosis for a minute, because do you believe fibrosis is a commonality in both lymphedema and lipedema?
Um, I believe it is a commonality. I was going to say, you get into some fuzzy areas.
Yeah.
um, so it depends on what stage of lipedema somebody's in. I think that early stage, both lymphedema and lipedema, you don't see fibrosis. But as somebody progresses, it's definitely a hallmark for both.
And so as a and we're not offering medical
Mhm.
advice to anybody out there right now. We
Correct,
just want you to
correct.
know we're offering insights from Marie's own journey and from her expertise as a medical professional. But certainly we invite and encourage you all to get your own medical attention, because it's not one size fits all.
Correct.
Everybody is unique and different. But we were talking a little bit about fibrosis, and then you said about the later stages. So it's so important to get diagnosed early and start managing early so it doesn't progress.
Correct, correct. Yes, and that's why we have started seeing cancer patients, particularly as early in their diagnosis as we can, because we find that we can keep people from progressing to those later stages and get them on a management program. It's so exciting to get emails and messages from patients who say, I've been doing really well and I had this thing happen and then I did this and this and this and I'm feeling better, to know that they can manage and that, I feel like I've done my job then.
Yes, and I can hear and feel your enthusiasm and passion for this work, which
Mm-hmm.
it's so important to be able to find the right therapist to help you.
Yeah.
What kind of advice would you give someone who perhaps just Googled and they're discovering that they have either lipedema or lymphedema? How do you find that caring, informed therapist?
Right. So look for a therapist who is designated as a certified lymphedema therapist. They should be trained to treat both lymphedema and lipedema. I will say that not all lymphedema therapists are comfortable with treating lipedema or maybe have as much passion for it. They should know how to treat it. And if you don't have a good fit, look for another therapist. There are other therapists out there. There are resources. So particularly the Lymphology Association of North America, or LANA, maintains a database of therapists who are certified through their organization. Several of the schools that train lymphedema therapists either have a database available, or if you email them, they can give you the name of a therapist in your local community who is practicing. I'm trying to think, National Lymphedema Network used to maintain a database. I think that they may be getting one up and going, or they have a small one. If you're in Georgia, the Lighthouse Lymphedema Network maintains a small database. So they're out there of therapists who, are certified. I think the biggest mistake and one of the hardest issues that I have to deal with oftentimes is a patient who comes to me who has seen somebody else who is not a qualified therapist, and they were fitted for some compression, or they maybe did exercises and it didn't get better, and the sleeve or the glove or the stocking doesn't feel right, is just overcoming that hurdle of what I do is different. It's gonna be a whole different process, and that person wasn't qualified to treat you.
That you've just offered so many resources and hope to people, which is the whole goal of these YouTube videos. So
Mm-hmm.
I'm super excited about it.
Yes,
You said something about it just doesn't feel right anymore. The importance of a patient listening to their body.
correct. Correct. And that's always what we go on, or at least that I go on as I treat folks, is sometimes it's not about the numbers or how much limb volume reduction we've gotten, or, you know, any of those things. It's more about, are you functional? Can you do the things that you want to do? Can you meet the goals that you want to meet? And I think in finding a therapist, you need to look for somebody who's focused on those things. More so than just absolute. I mean, it's important. We want to get volume down, but
Yeah.
you know, that's not the be all and end all.
I've learned that as well, because what I've heard from many women, particularly with lipedema, they just want their
Mm-hmm.
quality of life. They want to be able to
Correct.
get up and walk to the mailbox or
Correct.
play with their kids without
Right.
being in pain. And one of
Right.
the women I spoke with said, look, I just want to be able to play with my kids
Right.
and have that mobility. And so don't give up. If you've tried some things and maybe they haven't worked, there's more things to try. And there
Right.
are a boatload of resources to find them. So, you know, we're having a dual conversation about lymphedema and lipedema. Going back to lipedema, what do you think it's going to take for the medical community to really pay attention to this
Right.
condition, to diagnose it, and for the insurance community to pay
Right.
for the treatments that are necessary to help
Right. Right.
these mostly women?
Sure. That's a great question. I don't know that I have all the answers to that.
I wish we both did.
I wish we did. I think it's going to take some really systemic changes, and oftentimes, and again, I kind of borrow from different communities, but particularly the breast cancer community is very well mobilized as a group, and they have gone out and pushed for legislation and pushed for recognition and the importance of survivorship and again, doing those functional things. And so I think for the lipedema community to start to say there isn't any shame in this, and to be able to say, this is a medical condition that I am dealing with. I'm not obese, I'm not lazy, I'm not, you know, all of these things that are labeled to them. I think in doing that and getting the medical community to listen to them is really probably a first step. Unfortunately, we only have a very few people within the medical community who have any kind of passion for this to, you know, we feel like we're pulling along the rest of the medical community when it comes to lipedema.
Well, you made a very important point about patients being their own advocates, how the
Correct.
breast cancer community is organized and motivated. And what I'm starting to see out there, especially with all these online portals that I'm involved with, these women are starting to stand up and fight for themselves.
Right, right.
And I believe that that kind of motivation and organization can make for change. And your voice as someone in the medical community is so important. That's why we're so appreciative of you giving us your time today. So how can people find you if they want to either follow you online or find you physically in South Carolina? Because I know people are like, I'm sure there's a lot of people watching right now that are like, I want to go visit her. I want her to treat me. How can people find you and follow you?
Sure. So I don't have a big online presence, unfortunately. I'm so busy clinically that I just have made the decision not to do a whole lot that way, but I'm certainly glad to field emails, and maybe we can put that maybe somehow in the notes for this. I'm certainly glad to field emails. You know, that's probably the easiest way for folks to get in touch with me.
Perfect.
I also know that if you Google Columbia, South Carolina and my name or lymphedema, I typically will come up early in the Google search.
There
So,
you go. So for not
yeah.
having an online presence, good for you.
I know, I know. I said, everything out there online for me is associated with lymphedema and lipedema. So yeah, that's really where I am at this point.
Marie, I have to say, I so admire and appreciate, and I think I speak for a lot of our viewers, your heart that has been invested in caring for these patients. And so I'm going to leave you with the last shot to encourage the audience. If someone
Mhm.
out there is either beginning their lymphedema or lipedema journey, or maybe they are weary from managing this condition, what would you say? Look right at that camera and encourage them.
Sure, sure. Well, first of all, give yourself some grace. Um, it is so important that we not beat up on ourselves for the things we're not doing or that we haven't done, or to live our life backwards. Certainly give ourselves some grace. And then once we get to that point of forgiveness, then to, again, look for those resources. I never shut the door on patients. I always, you can tell when people come back to see me, they'll go, I've been bad. I'm like, there's no such thing as bad. We just need to tweak or do a tune-up on your program. So get back to whoever it is that has helped you in the past, and or find a new therapist, or whatever it is you need to do to get back on track, or to get that start going.
That's wonderful. Well, I
Yeah.
can't thank you enough for your time. Is there anything you want to share before we close out?
I don't think so. I don't think so. I just love what I do. I love the folks that I work with. I am so blessed every day to be able to do this.
Well, we're blessed that you do it. And the
Thank you.
lymphedema community is blessed that you do it. And I want to thank you all for tuning in to this edition of the Lymphedema channel. I'm also going to post this on the Lipedema channel because this is a dual story and it's a success story and it's a story of hope. Thank you, Marie. It's been a joy. And if you know somebody who would make a wonderful interview for this channel, send them my way. bviola@medsoulsupplier.com. It would be my honor to share their story because I believe in sharing these stories. We empower and uplift each other. And isn't that what life's all about? Have a great day, everybody. See you.